Welcome to Talking Tech Journeys, hosted by me, Ben Whiteley of BPM Tech. We're delighted to bring you season 1 of Talking Tech Journeys. The aim is clear: to bring you some of the most engaging and respected figures within tech and transformation, providing a snapshot of their journeys to share knowledge, ideas, and insights on all things tech and transformation. Sit back, relax, and enjoy the journey. Hi, welcome to Talking Tech Journeys. I'm Ben Whiteley, and I'm delighted to be joined by Dr. Lloyd Humphries, Managing Director at Cognis. Cognis are a no-code ecosystem to create advanced patient-facing digital health apps. Welcome, Lloyd. Really looking forward to this. Thanks very much for joining.
Oh, thanks very much for the invite. Really looking forward to the chat.
Good. Yeah, it's great to discuss your journey further and your thoughts on the future of hyper-personalisation, no-code solutions with health and social care. So let's delve straight in. So, how, why, when did you sort of first become interested in digital health and technology, Lloyd?
Yeah, well, most people think when they look at my LinkedIn profile or look at the CV, they kind of assume that it was with Breaking Free Online where we created one of the first digital therapeutics, but actually goes way back before that, back to the late 90s and early 2000s, which it's hard to imagine I'm that old. But actually, I was a clinical psychologist at the time, doing some as a trainee, and we were using paper notes, as you would expect, in the late 90s, early 2000s. And we were creating all of our case notes, but we also then had a case management system. And that case management system required us, after each session, to put that onto a computer system. And so we were duplicating all of the time. And then in the wisdom, they decided to bring in that NHS Trust, they decided to bring in a new case management system. And so during that transition, we were kind of logging all of our kind of records in two systems electronically and one system within paper notes. And so for me, it was my first kind of taste of digital. And for me, it was incredibly frustrating being able to kind of do things in triplicate. And I could see kind of the efficiencies that were the potential behind it. But actually, my first kind of foray was really like banging my head against a brick wall. And particularly when I realized that when I spoke to one of the IT people, into this transition period, they told me that all of the data from the old system was being deleted anyway. And so for me, it's like, what was the point of that? The deep inefficiencies. And that's kind of showed me when you could get it really horribly wrong with technology. And and that's still happening today in terms of some of those inefficiencies when you're bringing technology in. But it did show me the art of the possible. And so when I created with another co-founder, Jonathan Ward, when we created our first company called CPA, Clinical Psychology Associates, we actually kind of saw the power of kind of technology to be able to really provide psychological oversight for a lot more people than we could individually. And so what we were doing, we were working with some of the largest residential children's homes across the country, covering thousands of lives. And so what we brought in a computer system that we designed, we created, and we built, which allowed young people and kind of the staff in each of those care homes to have a structured conversation, to provide feedback into this computer system. And then our team of psychologists could review that, prioritize, allocate resources, and triage people. And so we could actually, using this very early system, we could kind of manage hundreds, if not thousands of young people's lives and be able to kind of triage those people appropriately and provide the right report, the right psychological assistance when it was required at the earliest time. So we weren't waiting for crisis. We were actually being able to intervene early, and we were able to then track outcomes over this kind of system. And so, it was one of the very, very early kind of remote monitoring, triage, assessment kind of platforms out there. It never went anywhere. It was only an in-house system, but it just showed us the potential for efficiencies that you could get from technology. And so when we did create Breaking Free Online, we brought a lot of that learning in. But that was kind of my kind of first foray. One was a really dreadful kind of experience, which showed me the possibilities. And the second was the ability to actually drive that efficiencies when it's implemented in the right way. So,
So
Those are
just to
the two
sort of
things.
take you back to that sort of first job, like say a lot of frustration, duplication. You set CPA up, which, as you sort of just touched on, that that then sort of became Breaking Free Online. So I mean, you've sort of touched on it there, but what do you think was the potential back then? And looking back, what do you think the sort of benefits that you sort of created in terms of the CPA and Breaking Free Online?
Well, what I really saw the potential was this multiplier effect, and I still talk about this, 25 years later
Yeah,
on,
yeah,
and that's the multiplier effect of technology being able to augment clinical care.
yeah,
We were able to kind of have much more reach many more people with technology than we were without it, and that
yes,
was kind of the point. When I was in the NHS, that was seemed to be admin for admin's sake, but
mm,
actually when we start to have a look at what you can do with technology, that multiplier effect is still true today, and that's what's really driven me in my career is, how can I help and impact as many lives as possible throughout my kind of career. And as a psychologist, I could impact just a one-on-one or maybe in a group session. With technology, you can then multiply that factor up, and there's no glass ceiling on it.
yeah. It's almost like the 1% build into a bigger sort of entity where you can add more value and efficiencies.
Absolutely. It's efficiencies, it's clinical outcomes, it's being able to provide the right care at the right time.
Yeah,
And more crucially, it's about meeting the person where they are. And especially true today is that actually we live
mm,
our lives, within our mobile devices.
yes,
That is kind of
yeah,
where we have our strongest relationships. It sounds daft,
mm,
and I'll elaborate on that in a moment. But
mm,
being able to meet people where they are rather than expecting them to kind of come in. And
yeah,
that means that we can reduce do not attends, DNAs, the cancellations, and we can start to impact people at every stage, throughout their journey,
mm,
rather than, in psychology, you might have one session per week, which is 45 minutes
yeah,
out
sure.
of 7 days of 24
Mm,
hours per day. And so how can we reach people in the gaps in between that care? And that's where technology can really help.
yeah.
So yeah, we need to meet people where they are, and that's the power of technology.
So what was the sort of appetite for online treatment programs, when you sort of created Breaking Free Online?
Oh, well, the appetite was there because the need was there. So when we
Mm,
created Breaking Free Online, it was really about helping people with drug and alcohol problems access appropriate care. And back then,
yeah,
if we saw the number of people with problem drinking, I think back then, if I remember correctly, the statistics were quite frightening in the sense that there was about 10 million people in the UK
mm.
with a problem drinking habit. Now,
Was
that
this circa
wasn't
2010? Sorry, it
yeah,
was.
this was around about 2008,
Yeah,
2010.
right.
Yeah, absolutely.
Yeah.
And there's about 10 million people that you could say would have a problem drinking.
Mm,
Now, that's not diagnosable alcoholism, but they were drinking more than what was
sure. Yeah.
recommended for them. But then the number of people being able to be serviced by alcohol services was around about 80,000 per year.
Mm,
And so there was millions of people
yeah.
that could have early intervention to help them,
Mm,
but they couldn't reach them. So, and even people with really kind of a strong addiction to alcohol couldn't access those services because there just wasn't enough people. And so the need was there. And so the appetite was there to try something new. But then there was that kind of risk aversion, the kind of the clinical safety
yes.
case
Yeah.
around that, etc. So there was lots of reticence, but there was, some of those people, those early innovators, those early kind
Mm,
of first movers that saw the potential. And we weren't the first in terms of online treatment. There'd been a
yes.
couple of programs before us. So the first one was called Beating the Blues, and that was really paved the way. And that
Mm,
was kind of what gave us the idea for Breaking Free Online. So Beating the Blues was a program created by Ultrasys that's no longer went out of business around about 2013. And they
mm,
really set the seed in terms of online treatment.
mm,
From the mid 90s, they created an online treatment based on a book called Mind Over Mood, and they would basically translated that Mind Over Mood self-help book onto a CD-ROM.
right.
And before that, it was even on a floppy disk. And most people don't even remember what a floppy disk is these days, but that's how it kind of started. And it had some amazing kind of randomized controlled trials and really kind of effectiveness. And that kind of really paved the way. So they really furrowed the ground, but that was purely and only for depression. So we were one of the first outside of depression, if not the first outside of depression, and particularly with a really complex group such as drug and alcohol. Your drug and alcohol users. So it was a great time to build technology.
And like say, one of the early innovators, no doubt, sort of very, very rewarding. So just sort of bringing you into Patient Know Best, you did, Europe's largest personal health record. So I know you spent some time there. So, I mean, how did your early years sort of set the platform for your career?
Yeah, so when I had Breaking Free Online, I left that business around about 2012, 2013, and having been a founder for 10 years, etc., it was one of those kind of moments that you kind of come out of a business in that way, and you've done absolutely everything. You've done the marketing, you've done the commercial, you've done the sales, you've done the finance, you've been a jack of all trades effectively as a founder. A founder has to be. And so when I left there, I kind of thought to myself, well, what do I do next? And the questions is, why don't I just do it all again and become another founder? And then my wife turned around to me and said, go and get a proper job. And so at that stage, I thought, well, if I have to get a proper job, you know, what does that look like? You know, is it in marketing? Is it in sales? Is it where is that? Where is my kind of natural home as a clinical psychologist that's turned to business?
Wearing many different hats.
Wearing many different hats. So I kind of scratching my head, and I was working with a recruiter, and I was just kind of scouring the internet, and I came across Mohammed Al-Ubaidli at Patients Know Best, completely unrelated to mental health, where I'd occupied for my entire career to that date. And I kind of reached out to Mohammed, and he didn't get back in touch with me. And he laments to this day, I cost him quite a little bit of money because he had to pay recruitment fees, because my recruiter then reached out to him, and we had a real interesting kind of conversation. I came on as the Vice President of Business Development. Very much into the kind of commercial arm of the business, being the only person within that commercial. We still argue whether I was employee number, I think, is it 4 or 5 into the company. So very early on. And so it was really working with Mohammed that I kind of then found that kind of niche in terms of the commercial aspects, rather than the product, rather than the marketing, etc. And it was really that kind of journey. And so that was really the start of coming in, and what's defined the sort of the last, I guess, 12 years is really kind of helping really first of type and disruptive technologies. And I don't really like the phrase disruptive, but really first of type technologies that are really carving out a sector for themselves. And that's really what's defined the last 12 years, is really helping those kind of those stage businesses to really kind of scale their enterprises, both within the UK and globally.
So give you a global sort of understanding as well.
Well, absolutely.
Exposure. Yeah.
I mean, with Patients Know Best, I think by the time I left, we were working in about 13 different countries, about 19 different languages, everywhere from Australia. We had a team in Australia to the Middle East to the US, and right across Europe. So it was it gave you that kind of global kind of understanding about the different value propositions that you have in different healthcare systems, and the different cultural factors of doing business as well in each of those markets. And that's kind of extended into when I've been at Silver Cloud, where I've worked kind of in the US, the Middle East, and Australia, and with Orca, again, kind of globally, and now with Cognis, which we're kind of a twin city, twin country, Australian and UK business.
Good. And just in terms of, we'll sort of come on to Cognis very shortly, but just to summarize, you mentioned of Silver Cloud and Orca as well. So in terms of any sort of key learnings, takeaway from this period of your career, or sort of any advice that sticks with you that serves you well today?
I think for me, and I always joke about this when people work with me, and I think the 3 words that would be kind of etched on my gravestone, and people would kind of say that, you know, these are very much true Lloydisms, you know, would be very much, you know, make sure that you focus on core, scalable and replicable business. So being able to have a real kind of narrow beam of focus. As an early stage business, you're often being pulled into a million different directions. Kind of stay true, but don't ignore the market. So making sure that you have a core business. It can't necessarily, every new customer can't be a new customer. They have to be replicable. And they have to be core to your vision and your mission. And often, especially in the early days, especially if you've got grants and funds and things like that, you're pulling the business to meet the specifications of those. And they can kind of take you off in different journeys, sometimes for the better, but sometimes they distract you from the core parts of what you're trying to kind of do. So, you know, just to be kind of careful, core, replicable and scalable. This has to be suitable, you know, at scale. So if the technology doesn't scale, if the commercial model won't scale, you know, none of those things, you know, if none of those things are there, then you're going to kind of get yourself into a whole world of hurt. So that's kind of my some of the three areas that I would lump together, and learn to say no as many times as you say yes. Often, you know, as a founder, as an early stage business, you're saying yes to everything. So sometimes saying no will stand you in good stead.
And I think obviously from speaking to health tech entrepreneurs, clinical adoption is another big thing with health innovation. You know, no adoption, sort of no success. So like I say, is really juggling all of those, I suppose, like we said, hats or lenses that people have got to focus in terms of upfront time invested, cost, people, resource, funding cycles, cash flow, etc. Which probably leads us quite nicely onto to Cognis and who you are and the sort of problems that you solve. So you've been Cognis now roughly 2 years, is that right?
Coming up for 2 years, yes, absolutely. It's completely flown by. So yeah.
So just for the sort of the listeners, you're the managing director there. I mean, who are Cognis and what problems do they solve?
Yeah, so Cognis is a no-code platform for creating patient-facing digital health apps, and I'll kind of go on to that in a little bit more detail, but I'll kind of talk about how I ended up at Cognis actually, because I think sometimes that's that kind of explains some of the problems that we're trying to solve, and actually, you know, what really excites me. And kind of feeds full circle back to my earlier days that, you know, when you're a clinician and you've got a great idea, it's incredibly difficult to bring that idea to market. Breaking free costs us the best part of £1 million, 2 years of our lives to build.
Wow.
You know, even that early system was, you know, we're talking nearly £100,000 of investment, even into that assessment and triage system, etc. So it's incredibly, takes a huge amount of time, takes a huge amount of kind of cost, and you need to bring in real specialist software developers, technical expertise. You know, I wouldn't know the first thing, you know, my JSON from my Python, you know, from any other kind of programming language, etc. So it's incredible. And so many great ideas go to the graveyard because of all of these kind of barriers and obstacles. And it is quite interesting within the NHS that we've got so much intellectual horsepower. We've got 1.3 million people working on the front line, you know, seeing every day the challenges, you know, being frustrated with a lot of those challenges, and also seeing how they might be able to change, you know, for the better, but actually kind of facing an uphill battle to be able to implement that change for all of those reasons. And so for me, if we could leverage that intellectual horsepower, if we could harness that, then actually we could make, you know, thousands, if not millions of little kind of cuts within the system that actually allows us to kind of make those changes that are necessary for that NHS reform that Keir Starmer is talking about. And so,
I mean, just on that, I mean, some of the sort of cynics and critics are often surprised how many people sort of just decide and build something on their own opinions and how things should work, you know, and how issues should be solved. So, you know, often the criticism that I hear from some experts is, you know, health tech or digital health is too many startups solving the same pain points and issues. I mean, how do you sort of validate, challenge?
Yeah, and I wouldn't necessarily, I would challenge that too much. I don't think that's 100% true, but there
Mm.
is a lot of technologies out there that are created through people's own, say, lived experience of the health system rather than their clinical experience. And that lived experience is very worthy. But then you've also got people who have lots of technology background and think,
Sure.
oh, I know how to solve that problem.
Yeah.
And the issue here is actually completely different to a clinician, or maybe a patient starting it, is because what they do is they start with a solution and they work backwards to the problem. They say, hey, I've built this really cool thing. Now, what problem can it solve? And so it works backwards. And actually, the best innovation, you start with the problem and you work out what the best solution is for it. And sometimes the best solution isn't technology. Sometimes it's a pathway redesign. Sometimes it's a workforce issue. But if you only start with the tech as the solution, you're kind of shoehorning that into the problem. And that's where you get the kind of the adoption problems and all of those things, because it's just, two worlds kind of collide in the wrong direction. And so that's often kind of the problem. And so for me, we need to kind of flip this and empower the NHS clinicians to be able to kind of solve some of those problems if technology is the answer, with technology removing those barriers. And so that's where I think we need, both, that lived experience, but also that frontline experience too. And so making sure, if you don't have a clinician on your team, make damn sure that you get a clinician really, really quickly. It should be kind of your first hire, and go and ask people, go and, sit in kind of a clinic or a hospital or wherever you're trying, and see what the problem is. And just be open-minded that the solution you think it is might not necessarily be the right solution for that problem you're trying to fix. So, and I'll put this in some statistical numbers for you.
Yeah, sure.
There's about 365,000 digital health products on the market right now.
Right.
And of those 365,000, only 20% of them reach any sort of criteria for quality or effectiveness.
Wow.
Which means 80% of those technologies are at best ineffective and at worst dangerous. And so there is a quality issue here. So it's not necessarily about more tech, although I think there's lots of areas where we do need more tech. It's also about the quality issue too. And that's kind of where we need to really kind of focus, as well as addressing some of the unmet needs. And when you see that 365,000, there's huge clusters in certain areas, and the huge clusters in, and you can probably guess them, mental health. There's a huge cluster of mental health apps, diabetes, cardiovascular disease. There's a huge kind of technologies, in what we would consider blockbuster areas where there's a large number of people experiencing that problem. And so when you've got large numbers of people, then what you can see is there's a commercial imperative to use a technology. Whereas there's large numbers of people where there is no technology for them. So people with rare diseases. So if we take, I don't know, plucking a rare disease, lysosomal storage disorders, if you look at Pompe, Gaucher disease, there's only about 500, 1,000 people, maybe a few more than that in the UK. No commercial company is ever going to build a technology for that, especially when it costs 334,000 on average to build a digital health solution. They're not scalable. It's not scalable. It goes back to one of my 3 points. It's not scalable. So those kind of groups of people are never going to get technologies unless we kind of remove some of those barriers. Equally, some community groups, so within that, even if you take diabetes, there could be people speaking multiple languages. And if we go back to my point about meeting people where they are, your technology must meet them in their first language, not the language that we're imposing upon them. And so there's lots of kind of that when we talk about a digital divide, I think there's an unwritten or unsaid digital divide here, is that we're not serving large portions of our communities. And so that's where we need to kind of address with more technology, because there isn't any. So more apps is not necessarily a bad thing, because you get personalization, you're meeting the patient where they are, and you get to bridge that digital divide. But they have to be of high quality, and they have to be serving a purpose.
So in terms of evidence, trust, real world evidence, obviously misinformation, etc. How does Cogni sort of help with that?
In terms of misinformation, well, we work often with kind of clinical entrepreneurs, hospitals or health systems, to help them and empower them to build, solutions for themselves in a sustainable way. So rather than relying on commercial off-the-shelf products, we empower them. And that's kind of, if I come full circle back to what Cognis is, Cognis, as I mentioned, is a no-code platform. So what this allows people to do, it allows any kind of healthcare expert or anyone with that great idea for an innovation to be able to build a digital health product quickly, cost effectively, and being able to get that into the hands of people quickly. So, for example, if I talk about costs, as I mentioned, the average cost is about £334,000. That's way outside the reach of most healthcare systems, particularly if you're reaching certain groups. If it takes you on average 1 to 2 years to build your product, you need it now. No hospital, clinical entrepreneur has 2 years of their life to get something off the ground. And you've also then got all of the regulatory and compliance issues that go hand in hand with that. So, that can be a big barrier because it's a whole sea of letters and numbers. So if we just take the UK, for example, the regulatory landscapes, even if we don't talk about medical devices, then you still have to be DSP toolkit, data security protection toolkit. You still have to have a DTAC, a digital technology assessment criteria, cyber essentials and cyber essentials plus, ISO 27001, 13485, 82304-2. It's a whole kind of litany, which anyone creating technology would just fall down a rabbit hole really quickly. So there's all of these kind of barriers, and what Cognis aims to do is remove as many of those as possible. So what Cognis is a no-code platform, as I said. You can go into the platform, you can upload all of your content, you can design your pathways, design how it should look and feel. And at the bottom of the screen, when you click Save Changes, your app is built immediately live on demand. Not a single line of code, no need to kind of understand any sort of technical language or technical expertise, no need for software developers. You can build technologies in a matter of hours, days, and weeks rather than years. And at about 90% of the cost of a software development house doing it for you. So suddenly you can start to see how health systems can innovate for themselves, that actually they don't need the time, the resources in order to reach kind of their local community. And this is where we start to talk about hyper-personalization, being able to kind of create technologies built by the NHS for the NHS, by the local community for the community. And so you can then start to see that it starts to resonate more. You can see that actually if clinicians from that area have been involved in the design and the build and the shaping of that, then they're going to be wanting to adopt it and to use it and to kind of promote it, rather than a technology which is often, bought without their kind of knowledge and say so, being foisted upon them and then being told to use it. So you can see how right the way across that digital health journey, you can see that kind of no code can have a real kind of impact on the lives of people.
Very agile sort of way of working as well.
Well, yeah, I can bring that to life. So we had an internal challenge to see how long it would take us to replicate one of the world's leading mental health apps. The case study is on our website. And so one of the leading mental health apps, they spent $10 million and 2 years building this solution. We challenged one person to see how long it would take them to replicate this, all of the features, all of the functionality, the look and the feel, using publicly available content, and see how long it would take them. It took one person 11 hours to recreate the world's leading mental health app. And we've got lots of examples of building apps in a matter of hours. But even when people are unfamiliar with Cognis, just recently, we've had a number of people we had someone build a CBT app for depression in about 3 weeks. We've had someone build an app for autism and people with neurodivergence. A wonderful one in terms of helping them to identify different emotions. And they built that in 3.5 weeks. And so you can start to build these literally in a matter of hours.
Like you say, really breaking down those barriers and doing it in a proper, secure, compliant way, which is what the industry needs, really. So just in terms of sort of case studies, customers that you sort of you've had some major success with. I mean, are you able to just sort of give some live relevant examples of who you've helped and some of the outcomes?
Yeah, I'll give you one. And Ruby Jackson, who I'll talk about, yeah, just been interviewed by the BBC, a phenomenal person, and is part of the NHS Clinical Entrepreneurs Programme, and has just qualified as a midwife. So was building this as a trainee midwife. She actually won a competition that we ran in combination with AWS and the Validitron, which is the University of Melbourne's digital health validation unit. And she won a competition to build an app on Cognis. And her premise was that, unfortunately, babies with black or brown skin are 3 to 4 times more likely to die in childbirth in their early years than if you have white skin. And partly that's because midwives and doctors aren't trained to recognize those sorts of issues in different colored skin. So being able to spot jaundice, being able to spot rashes in black and brown skin. And so what she wanted to do was to kind of create an app to help healthcare professionals, but also parents as well, to be able to spot those signs. And this is a really kind of wonderful idea, very simple, but incredibly important. And so she's built that over a matter of weeks, and she's just submitted it to the app stores, and it will be available very quickly. But you can just see how much of an impact that simple kind of idea can have, on hundreds, if not thousands of lives. There's another one that's just about to, might have just gone into the app stores as well, which is a childhood sepsis app built by the University of Plymouth. And this one was the idea that, too often parents are attending to A&E, or more crucially, they're not when their child has a fever. And sometimes that fever is somewhat just a child having a normal cold, etc. But sometimes it's a sign of sepsis or something more serious. And so having an app where you could actually look at the signs and the symptoms and how they piece together, and the certain age of your child means the presentation is slightly different. So this app actually, based on the age of your child, you can then get a whole set of symptoms which differs between how old they are, and you can see, what you should do in that situation. And so again, you can kind of see the potential to impact and save so many lives just by having that information close to hand. So yeah, there's lots and lots. I think there's about 108 apps that have been built on Cognis. There's huge numbers that are in the app stores, both in Australia and here in the UK. So yeah, I could talk lots and lots of more case studies, but it just gives you a flavour of some of the impact that that Cognis can have when you start to empower healthcare experts to create these technologies.
Pretty amazing. And I know that Cognis, you're all about building sustainable ecosystems, as you said, removing barriers, time, to sort of share knowledge, sort of regional, national sort of level. You've got the Innovation Sandbox, Innovate Forums, the Cognis Academy. I know you sort of, I think Ruby was part of was it the Digital Health Challenge that you just touched on?
Yeah, that's correct, yes.
So how does that fit within the overall Cognis Academy? And
yeah, well, the Cognis Academy is designed to help people get used to and familiar with Cognis itself. So that's just that's not just, it's a training academy that helps people understand how to use the platform, and that's wonderful. And you can go through that academy in just a matter of hours, and so you can be an app builder literally in a matter of hours. I remember going through the first part of the academy, in an hour, and then starting to build my app in the second hour. And so that's the sort of speed and the learning curve, that the Cognis provides. But there's lots of ways that we help different sets of innovators. So sometimes people come with us with a really full idea, and they just kind of get started. Other organizations sometimes might have an end of life product, and they say, right, well, actually it's costing us far too much money to update an aging kind of technology. Why don't we re-platform? Because Cognis, by its own kind of infrastructure, has to update every single time there's an app store update, etc. And to give you a flavor of that, I think iOS 16, so Apple iPhone, there was, I think, about 26 updates to iOS 16. And so if you've got to stay abreast of each of those updates, that's a real kind of huge kind of impact on your tech teams. And that's just in terms of doing that, let alone all of the changes that you want to do to make your product better, etc. So often people re-platform because it's much faster and much quicker to do that. And so we have, a whole wide range of kind of customers, some really big organizations, sometimes just a clinical entrepreneur. And so we have programs for every stage of that kind of developmental life cycle. So we do have an innovation sandbox, a variety of them, depending on who's supporting them. So I guess a good example of this is Health Innovation East's innovation sandbox. So this is one of the health innovation networks. I think there's 14 or 15 of them across the UK. And Health Innovation East support innovation in the east of England, covering around about 6 million people. I think it's about 4 integrated care boards. And so what they have is their own innovation sandbox, where they run 2 cohorts per year, where any local innovators can apply to that sandbox and build out their prototype, their minimum viable product. And they got 6 months to do that. And then they can spin that out into a commercial platform or take that back into their hospitals, or they can commercialize it outside if necessary. And that's a really great relationship with the local NHS integrated care boards, the Health Innovation Network and Cognis, really trying to accelerate and enable that kind of innovation life cycle within that particular area.
So breaking down, like I said, that those barriers and driving the innovation. So it's good to see and very clear with like say, the vision and mission of Cognis. So just sort of in terms and sort of finally in terms, there's lots of talk about AI, the links between health, behavior. I know you're very passionate about hyper personalization, gamification maybe. And you've also discussed the idea before of a super app in store. So what's your thinking, rationale behind this?
Gosh, there's lots to unpack there. So the first one is if we talk about personalization and gamification and all of those things. So all of those things there, sort of gamification, personalization, having an app kind of respond to your input, that's all about engaging with that person, making sure that it's not just a flat experience, one screen after another, that actually it kind of engages with you and drives that behavioral change, whether it's to engage in your treatment, whether it's a behavioral change, whether, whatever kind of outcome you're looking for. If that app feels like that it's tailored to you and your own needs, and that actually by doing so you can gain a positive outcome, whether that's kind of in gamification in terms of rewards or vouchers or points, or whether that's a clinical outcome, then actually all of those features and functionality are really key. And so Cognis has all of those features kind of built into it. So you can do full gamification, personalization, you can create multiple pathways. So for example, if a user answers a question in a certain way, you can take them down a different pathway. If they don't log in for a week, you send them a notification and send them to a different part of the app. So by doing so, you can start to really gain that engagement from the end user. And that's kind of really critical, because otherwise people will put down their phone for something more engaging. And so that's kind of really, really key, that hyper personalization, but also localization too. Being able to build it, as I mentioned earlier, the local services being able to build for local kind of needs. Again, you can be able to kind of do that. So that's kind of really key in terms of that. And what you can do there is use lots of algorithms. And that kind of brings me on to AI in the sense that lots of AI isn't really AI. It's complex algorithms. Lots and lots of if then. So if the blood pressure is this and the person has this kind of demographic profile, then you do this with them. And so there is lots of talk about AI without it actually being kind of real AI. When we actually kind of and Cognis does a lot of those algorithms, so you can have lots of that kind of, again, we call that personalization and behaviors based on certain criteria. So you can build those really complex apps right now. And so we call that AI for event-driven personalization. It's not kind of your generative AI, it's not machine learning, etc. However, you can plug in AI models, large language models, generative AI, all of those things, you can plug those into Cognis, and we're working with partners to be able to do that. So you can build an AI model, a really complex one, plug it into a Cognis app, and so you can collect all that data, you can get all of that, pushes that through the AI model, and then the result from that comes back into an app you've built on Cognis. So you can start to build those kind of AI kind of technologies using Cognis and some of the partners that we're working with. So the future is incredibly kind of powerful when you start to bring these different technologies together. My kind of thoughts on AI, there is a lot of talk at the minute. A lot of AI companies are kind of really struggling for a couple of reasons, I think. Firstly, actually kind of the risk averse nature of kind of the NHS. And this is new technology. And when you kind of furrow new ground, you're going to get that risk aversion. So whilst it can offer a huge amount, particularly a lot, and we talk about black box kind of AI where you can't really see the model behind it or what's generating the output. Some of those black box AI, they're going to kind of really kind of struggle, in terms of being able to satisfy the NHS in terms of their risk aversion. But also a lot of those AI, they've got the AI model, but what drives that AI model is data. And a lot of them are needing to work with the NHS in order to get that data, to be able so the model can learn, so etc. And so when you've got a risk averse NHS that has all of the data you need, and then you've got an AI model that's desperate for the NHS to work with you and release that data, it's really difficult. So I think that those barriers will kind of come up. But I think, the NHS is kind of struggling with, how do we regulate this? What's the standards that we need for this? How do we kind of keep people safe, and that we're, the clinical safety associated with it? So there's huge kind of potential for it. But I think we're in really, really early days with it. And I think, it's not going to be this thing that kind of happens overnight. There will be a few success stories, and we will hear of those success stories. But there's going to be an awful lot of people that we don't hear about because they're struggling with that kind of dynamic.
No, fair point. Like I said, there's a lot of risk, but also, the rewards could, who knows what the future can hold in terms of, like say, all things tech and AI. But it's all about the risk and adoption.
Absolutely. And it's, and AI is just another way of being able to enable and free up clinical time. And if we kind of rewind right to the start of the conversation, 24 years ago, when we were having that triage and assessment, that was all about freeing up time with the technology that was available at that point in time. Now we have much more complex, and we're able to do much more with technology. But it's all about being able to enable clinicians to do their job. It's not about replacing them. My kind of big kind of statement around this, and I won't claim it as my own, but the calculator didn't put a load of accountants out of a job, did it?
Very true.
And so, but what it has done is help people drive those efficiencies.
And obviously, just lastly, I know that you're all Cognis is very app driven. Talk to us about the super app.
So the super app is one of those ideas, and there's two elements to this. So the super app is the idea that you can have one app within an app store, and underneath that you can have lots of other apps that sit underneath it. So if we take a fictitious integrated care board, they could have a digital kind of library or a digital front door. So they could have one app in the app store, and that can be a gateway to a whole series of different apps underneath it. Perhaps that's one for depression or nutrition or weight loss or diabetes, but equally it could be information about the local hospital, local support groups, etc. So you can have all of these different apps underneath it, and that means that you don't have to download hundreds of apps. You've got them all in one place that you can kind of browse, or they can be made available via kind of a clinician or the health board that's implementing it. So that's the idea of being able to create these super apps, being able to meet all of the needs of the population.
So that's the idea. That'll help with the personalization as well.
Absolutely. So
Yeah.
for example, what you could do, and Cognis allows this, what you could do as a clinician could say, right, I want to give you a nutrition, a weight loss, and a depression app, as well as information in terms of local support groups. And so you can say, right, I'm going to give you access to these 4. Give that patient a QR code, and so you can almost get an app on prescription that's personalized to that person's needs. Whereas the next person might come along and they might need something else, pregnancy advice, kind of nutrition, etc. All of those things. So they get a different kind of prescription, if you like, or a different kind of set of apps, and you give a QR code to that individual. So you can start to personalize the digital experience in that way. So there's lots of kind of opportunities there for that, and even down to a digital health company. They might have different products that they want to have in different kind of territories, and a super app allows them to do that.
Yeah. I mean, how close to you are you with that? Is that, have you got customers, clients who are sort of creating that, or is that something?
Yeah, absolutely. Yeah. So our one of our largest customers has 24 apps on their super app, underneath their super app.
Brilliant.
So yes, we've got number of clients that are starting to build those digital front doors, those digital experiences using that whole super app approach.
Good. Well, look, it'd be interesting to see obviously the future of that, and some of the sort of benefits are probably very clear, but like I say, the evidence would be great as well. So, well, look, Lloyd, many thanks for your time today, and great talking.
Thank you very much for the opportunity.
Great. And just to the listeners, it'd be great to hear your views and opinions on creating a sustainable ecosystem to help remove the barriers to drive future innovation with health and social care. Thanks for listening.